Hi, I'm Dr. Steve Jordan from the Tallahassee Orthopedic Clinic. Today we're going to go over the basic exercises during your rehab for ACL surgery. Rehab for ACL surgery takes about 6 months. At one time we tried to accelerate the rehab, but we've learned that the graft takes about 6 months to heal. So we have to teach you what exercises are safe, how to do them, and to go slow and protected. When you go home, you'll have a wrap, a cooling blanket, and a brace on your leg. You'll have instructions from the surgery center on how to manage these. I'm going to go over the exercises. I'd like for you to wear the brace when you're up and about to protect the leg, as well as to remind your friends that you've just had surgery. You don't have to sleep in it. As far as weight bearing, I like my patients to use crutches for 2 weeks to prevent injury and to keep you from going too fast. But if you feel comfortable putting the foot down, that's okay. The rehab is divided into 3 phases, and I'll go over each one of them separately. So now we're going to go over the phases of ACL rehab. Each phase lasts 8 weeks or 2 months, 6 months total. The first phase is very simple. We have 3 objectives. Get range of motion, develop strengthening, and don't hurt yourself. So to get range of motion, first and foremost, we want to get the leg extended. Place your heel on the coffee table or on a rolled up towel and let the leg slowly bend. Don't force it, but relax your leg and let it slowly bend. Work on this every day. We're also going to work on flexion in a minute, but while we're in the straight position, we can work on muscle strengthening of the front of your leg called quadriceps setting. Tighten up the muscles in your leg. Just like that. Hold it for 10 seconds. Count to 10, hold it. Relax. Tighten it up again. You'll be surprised how hard this is to do right after surgery. So, leg extension, quadriceps setting. Next, we're going to work on leg bending. Slide your heel up. It's called heel slides. You just slide your heel up. You try to get it closer and closer to your body. So we've got extension, we've got flexion. In this position, with your heel slid up, you can also work on the back of your leg, the hamstring. Dig your heel straight down into the table and it tightens up the back of your leg. Dig your heel straight down and it tightens up. That's called a heel dig, tightening up your hamstrings. When you've gotten good at those two, you can start straight leg raises. Everybody remembers that? Lift your leg up straight, hold it 10 seconds, let it down slowly. Lift your leg up straight, hold it 10 seconds. This also helps develop and get your core stronger. Let it down slowly. You can do ankle exercises, you can do hip exercises. Megan, roll on your side, she'll show you hip raises. Just lift your hip up and let it down. All these can be done to help strengthen the muscles around your knee. These are the main exercises and the most important things to do in the first 8 weeks of your surgery. You don't want to go fast, you don't want to jump, you want to be careful on wet surfaces, and you don't want to make quick turns. Be careful around animals or people that are playing. After the first 8 weeks, if you have good range of motion and good muscular control, you can begin phase 2. Phase 2 has 5 exercises that we're going to add. You can also continue the riding the stationary bicycle and the exercises from phase 1. Use those as a warm-up. The first exercises in phase 2 are isometrics and well leg lifts. With isometrics, you keep the leg in one position. You use the good leg to hold it there and you push against it with the operated leg. So push down with the operated leg and you're holding it with this one. Tight, tight, tight. Hold it 10 seconds, count out loud. Bring the good leg over. And now you try to extend against the good leg. That's an isometric. Count 10 seconds. Push, push, push. Hold it. Do isometrics 15 times in each direction, holding it 10 seconds. You can do more if you feel good, and you can do it 2 or 3 times a day if you'd like. The next is well leg lift. In the same position, use your well leg, lift the operated leg up, then let it down slowly. Use the well leg, lift the operated leg up, and let it down slowly. You can do these over and over as well. Following this, we go to hamstring curls. Hamstrings are bending the back of the leg. You can do it against a wall or table. Just bring your heel up toward your body, up and back. Keep your leg down straight. Bring your heel up. If you get better and better, you can put a small ankle weight on and do these exercises. Got to work on the front of the leg and the back of the leg. The next exercise is squats. You can do it up against a wall or somebody helping you. Stabilize yourself. Start first by going slow and come up. Slow and come up. You can go down further as you get stronger. Come up. You want to do 15 times 3 sets, like all the exercises. That's a good number. Don't hurt yourself. If it's painful, don't go that far or stop doing it. The last exercise of the 5 in phase 2 that we're adding is called high knees. High knees, you stand and lift the leg up, hold it, and go back down. Lift it up, hold it longer and longer, up to 10 seconds. Let it back down. Do it with the other leg. What this does is it allows the operated leg to gain balance and to get stronger while supporting you. 15 times each, 3 sets. That's great. Those are the 5 exercises for phase 2. In phase 2, we want to get stronger. We want to maximize range of motion, continue riding the bike or walking for exercise and endurance, but again, avoid cutting, quick motions, or jumping. After 4 months, you should have good range of motion and good strength and hopefully no swelling. Hopefully just minimal pain. The third phase is what we call return to sports or return to play phase. We start functional drills, running straight ahead and sideways. We start figure of 8 drills, zigzag drills. You can start jump roping in the third phase. We recommend you go to a therapist. We don't have the space to demonstrate these here, but these drills are slowly to progress your strength and balance and your position sense on your new knee. You shouldn't return to cutting sports until you've talked about it with us, but at about 6 months we can start that discussion. The third phase is 2 months of running drills and position sense drills. So that's our 3 phases of rehab for the ACL surgery. Again, it takes about 6 months, 2 months in each phase, range of motion, strengthening, position sense, and then functional drills. If you do all those good, don't have any problems, we can talk about returning to play or any sport you enjoy at 6 months. Have fun.